You can fix your back pain in just 10 minutes a day by doing the exercises right here in this video. When you understand back pain and where it's coming from, it's very easy to fix. So we're gonna get right into it. Do these exercises consistently, and you're gonna be able to beat back pain, and you're gonna change your own life. Number one, the first thing to know is that back pain, 99% of it comes from a hypermobility, that we're moving too much through certain areas through our lumbar spine. Our body's gonna take the path of least resistance. If we cut away all the muscles, all the guts, you'll just see the skeleton. Whether you're a girl or guy, we're 99% the same with our skeleton. So the neck is exposed, we just have muscles around it. Right here at the thoracic spine, we have the rib cage, we have joint capsules, we have 9 muscles that overlap. We have the thoracic spine, we have a lot of stuff going on right here that'll get stiff on us. And then right here, we're exposed again through the lumbar spine. And then at the pelvis, we have a lot of stuff going on. So if our body's gonna take the path of least resistance, we're gonna get stiff in this area right here. We're gonna get stiff in the hips and the pelvis right here. And so when we're stiff in these two areas, we start moving too much through our lower back because it's just easy to move through there. And that creates a hypermobility. It moves too much. And so we just keep grinding and grinding on that tissue. So we're just doing this all the time, grinding up. And that's what causes inflammation, that irritation in our lower back. And a lot of people aren't able to get out of it because they don't break that pattern. In this video, we're gonna go through exercise on exactly how to break that pattern and get you out of back pain. We have to attack our hip flexors, our glutes, all around our pelvis. We have to loosen up those muscles right there. And then we got to make sure that we're not moving through our back first. So that's what we're going to attack with these exercises. The first thing we got to loosen up. Exercise number 1 is loosen up our hip flexors. Our psoas major is the biggest hip flexor in the body. And so what I'm going to do is I'm going to put pressure right here. So you can see my pelvis right here. I'm gonna comb right inside of it, and I gotta unweight that leg. So I'm gonna lay down to the side right here. We call this the samurai suicide. It's called seppuku, where a samurai, if they're disgraced, then they kill themselves by stabbing themselves. So that's what we're gonna do. We're gonna stab ourselves in this muscle right here on the pelvis, and I'm gonna hold this for 1 minute, just loosening up. I'm combing the inside of the ilium right here and making sure that I'm loosening up this muscle tissue. So I do it for 1 minute, and I'm gonna switch sides. I always do things bilaterally. I wanna work each side to make sure that both sides are working together. When we're walking, we are doing a reciprocal motion. We're using one leg, then the other, and so they have to work together. So we wanna loosen up both sides. So just 1 minute loosening up those hip flexors is the first thing. You'll be amazed at how much of an impact that'll make, and I can guarantee that you're not gonna find a video online where people show you how to do that unless you have a different type of tool. There's a bunch of tools that they sell where you can lay on the ground and grind on it. This is a really easy, you can use a broomstick if you want to, but we're getting right into that muscle. We're doing it for a minute. Let's get to number 2. Number 2 is a glute rollout. We got to loosen up these muscles in the glute. If I have a corkscrew right here, tight in the glutes, it's pulling on my lower back. So I'm loosening up the front of the hips and loosening up the glutes on the back side of the hip. So what I'm gonna do is I'm gonna lay down right here. I don't wanna lift my butt up. That's the biggest mistake that people make. They lift their butt up and slide underneath. I want it off to the side right here. So you'll see for a guy, it's right at our belt loop. This is my hip bone, my greater trochanter. This is my ilium, my pelvis bone. So in between, so halfway in between, and then coming straight down. I'm gonna take my right arm and my right knee, and I'm gonna shift over to the side, and I'm gonna put pressure on it. And you just stay right there. We just relax right here. You can move this leg around just a little bit, but I don't wanna be twisted up in my low back. I wanna limit motion in my lower back. So I'm resting, just relaxing on here. Same thing, we're gonna do it for a minute, and then I'm gonna switch sides. This is all about consistency. It's not about doing it for the longest period of time. I switch sides, I roll into it. This side, this right side is pretty tender for me. So I may wiggle, just glide a little bit into a spot that hurts more, and then I'll move that leg around. You're just breathe and relax, just gliding, letting your weight, the weight of your body, just press into that ball and loosening up that muscle tissue. It's gonna make a huge difference when we do the exercises. We gotta work on mobility first, and then we start strengthening the right areas. Let's get into number 3. Number 3, we're gonna use a double across balls, something that's big. I also have something like this. This is called a MOBO. We can put a link in the description, but this is a double lacrosse balls. We want to lay on it. So this is what we found is best for women. They're a little bit more petite. For guys, we use something like this. If you have a really stiff back, we use something like this. So you can also just roll up a towel and lay it sideways across your back. I'm going to show you exactly how to use it. So we're going to lay down right here. Remember, I want more movement through my thoracic spine, more movement through my hips to limit how much my low back has to move. So I'm gonna set this up, I'm gonna lay down to the side, and then I'm gonna roll back on it, and I'm just gonna breathe and relax. So right there, if you could hear it on the mic, that my chest just popped because I'm pressing on those ribs on the backside. Now my back just popped. So I'm breathing and relaxing, and we always teach our clients to do this for breath. So I do 5 breaths. They seem like long breaths, but they're really important. So what we want to do is now I want to slide my body down, and I'm going to do 5 more breaths. I'm not going to make you sit through that, but I'm doing 5 breaths right here, slide my body down another inch, do 5 breaths right here, and then I'm just relaxing. Now I've mobilized that around my back. You can do a little bit more if you want to, but let's be consistent with that. So 5 breaths in 3 different spots in between our shoulder blades. I'll show you on this model right here. I'm going to start at the bottom of the shoulder blades, just above, about an inch higher, and about an inch higher right there. That's typically the apex in somebody's back. Where the curve happens is about right here. We want to get that mobility right there, so we move through the thoracic spine, we get more rotation, and we get rotation through our hips, and we stop getting that extension through our lower back. So now we're going to do exercises to make sure that we're firing up the correct muscles. Now, exercise number 1 or exercise number 3, if we include the mobility, is going to be a bird dog. So I want to get here, and people make a bird dog really hard by doing an arm and a leg at the same time. The best way to progress it is we'll do an arm and try to stay totally still. Like a laser pointer's in your belly button. It stays directly in the same spot. And I'm just going to go here, come back down, and try to keep it in the same spot while I switch sides. And I'm just doing 5 with each arm. Now, if you feel comfortable with that, then we'll do our leg back. So we try to keep that laser pointer in the same spot. And I'm gonna tap that foot back. Try to keep the laser pointer, tap that foot back, tap that foot back, tap that foot back. What I don't want to see is when you do the bird dog and you do the arm and the leg at the same time, what people do a lot of times is this. And so now they're doing back extension instead of keeping themselves stable. So if you're ready to start doing the arm and the leg at the same time, which is the 3rd progression, I'm going to come here and I'm going to tap and I'm going to try to stay in the middle. I shouldn't be extending through my back at all. We always do sets of 5 on each side, so it's a total of 10. So our second exercise is side steps. So what I'm gonna do is I'm gonna clip this right here around above my knees on my legs. So I wanna get in this hinge position where I'm using my hamstrings and my glutes. So now I'm gonna go to the side, and let me go ahead and scoot a little bit so you can see me. So we're going right here. So I'm gonna go, my feet are going to stay totally straight, maybe a little bit in, and I'm gonna kick my butt back, allowing my chest to come down. I'm gonna take 1-inch little steps. Biggest mistake that people make with this is they take big steps. Now I've lost that tension on the band. I wanna keep that tension on the band, so I do 1-inch little steps, staying in my hinge position, and I'm gonna do 5 one way and 5 the other way. I'm really working the outside of my hips, working my glutes right here. I'm gonna show you from the side. We always do 2 sets of everything. So 2 sets, 1 inch, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Now you can see that my back stays in a neutral position. My knees just right above my ankles. My butt's kicked back. My spine's in a neutral position. My face is in line with my chest. You keep that position and we're not moving too much through the lower back. So we make sure we're firing up the glutes, we're firing up the abdomen. We've loosened up the hip flexors and we've loosened up the thoracic spine. We loosened up the glutes so that we could use them more. So let's get into the next one. The next exercise is the world's greatest stretch. Remember, these should take less than 10 minutes to knock these out. I'm doing a little bit more of an explanation. If you want a video where we just go through the exercises in 10 minutes, leave us a comment and let us know and we can put that together for you. Right now we're going through the explanation. So I need my thoracic spine and my hips to move better. So now that I've warmed up all those muscles and got them firing, now I'm gonna kick my leg back and I'm gonna do a squeeze with my back glute. This is called a modified world's greatest stretch right here. So I'm squeezing that back glute for 5 seconds, and then I'm gonna rotate with my arm. Squeezing that back glute, rotate with my arm, 5 seconds, and then I'll switch. Kick the other leg back, squeeze that back glute, driving my left hip forward, and then 5 seconds, keep that glute squeezed and rotate looking at the hand. So I'm getting motion and loosening up my hip flexors and then rotating again my thoracic spine to move. Just like if I'm moving around and rotating, playing a sport, I'm moving through my thoracic spine, I'm moving through my hips to limit the motion through my low back. Let's get into the next one. This is the last one, I promise. This is the last one. This is the hip hinge. So we talked about getting in this position with the side steps. I want to do the same thing. I'm going to get up against a wall or get up against a table, a bed, and I'm going to keep my face in line with my chest as my butt goes back, touching right here, and then my butt comes forward. My butt goes back, my butt comes forward. So I'm doing a hip hinge. So I'm hinging at my hips and then driving my hips forward. I'm allowing my knees to bend, but they're not shoving forward. When I do this, it should not cause any pain in my knees and it shouldn't cause any pain in my low back. I just feel a pull and a burn in my hamstrings. After about 2 or 3 weeks, you'll start feeling a burn in your glutes. So when we do this, we do 2 sets of 15 because we're retraining a movement pattern. This really works if you do it. So 2 sets of 15 of that. We've knocked out our program. Make sure you follow us for videos on exactly how we fix back pain in the clinic. It's our specialty. It's one of the easiest things that we do. When you're doing this at home, like, leave us a comment. Let us know what you need, what directions and clarity you need. But give me 2 weeks, twice a day with these exercises for 2 weeks. And I swear it will change your life if you're dealing with back pain. We're gonna be moving through the right areas. We've changed the way that our muscles have tension. We've loosened that up and then we've fired up the correct muscles and we worked on a movement pattern change. All 3 of those things have to happen in an exercise routine if we're gonna fix a pain problem. We'll see you in the next video.